Does our metabolism need to slow down as we age? Not necessarily. A little bit, but not a huge plummet. My name is Dr. Droliviajoseph, and I've been passionate about clinical nutrition and functional medicine for over 20 years. I've seen thousands of patients, and one of the most common things I see in my practice is metabolic inefficiency. Metabolic inefficiency is when your blood sugar starts to go up, your cholesterol starts to go up, your weight starts to go up, your thyroid function starts to go down. Now, these are not all inevitabilities because of aging, but these metabolic inefficiencies feed off each other. Many people don't know that when your thyroid slows down, cholesterol goes up. Part of your cholesterol is related to blood sugar. Blood sugar correlates to weight gain. So we have all these metabolic markers that you see getting worse as we age, but it has to do with metabolic dysfunction, mitochondrial dysfunction. So it's super important that we learn earlier on, ideally by our 30s, because around age 30 to 50, your metabolic system is slowly becoming more inefficient. But then after age 50, it can happen at an accelerated rate. Now, part of that has to do with your hormones. So you want to make sure that your metabolic markers are stable, that you've got good lipid health, healthy blood sugar, A1C, fasting insulin levels are low, optimal thyroid function. Ideally, we're seeing a TSH between a 1 and 2, 1 and 3. 3 is my upper limit for that. We're checking to make sure you don't have autoimmune conditions, that you're ANA negative, you don't have thyroid antibodies, your inflammatory markers such as C-reactive protein aren't elevated. Because when you see these things start to go south, you don't feel good, you gain weight, you can't lose it regardless of what you do. So it's important that we have a healthy diet and a healthy lifestyle, that we exercise. But it's also important that we detect and correct these metabolic inefficiencies, because one snowballs to the next, snowballs to the next, snowballs to the next. You go to an endocrinologist when you have a thyroid problem. You go to the endocrinologist when you have a blood sugar problem. Well, most people don't realize that those are two systems that are feeding off each other, and they're going to influence things like cholesterol and weight. We don't want these things to go south just because you're aging. It's not because you're aging. It's because you have one metabolic inefficiency that leads to the next, that leads to the next. And keeping your hormone system balanced, whether you're a male or female, is a big part of that.